Hey everyone.
Hi, Monique.
Hi.
Morning. Just in a second. I was Zoom hopping. Gonna pull up stuff. Can you guys hear the construction going on at Colatina next to me, or is that?
No.
Okay, good. Okay, it's really loud here.
What are they doing at Colatina?
I don't know. It sounds like a sander or something, or a saw.
Now's the time.
Or maybe it's like a floor buffer or something. I don't know.
Yeah, well, this is a good time to do interior renovations.
That's for sure.
Absolutely. Sorry.
Sorry, the problem being at the space is people are like tapping on the windows. Okay. Cool. Thanks everyone for joining. We'll get started. I think first there's a few new people on the call. I hope I don't forget anybody. So if you could just, we won't do whole introductions again, but the few people, if you could just kind of say who you are, and you can just say if you're from Bradford or what organization you might be representing. Let's start with Lisa.
Hi guys, Lisa Culbertson, Director of Employment for Upper Valley Services. We are all working remotely from home. We are considered an essential service, serving people with developmental disabilities and elderly through our Comforts of Home program. So we are still, providing services as needed. Most of the people that are employed are not working. There are a few essential people that we support that are still working, but we are available. So let us know if there's any needs.
Awesome. Thanks, Lisa. And Dan Perry, the fourth.
Yeah, I'm here as the president of the FAST Squad, president of Bradford.
Thank you. Ryan Terrell.
Yeah, I'm here as the Bradford Fire Chief.
Awesome. Thanks. And Josh Danforth.
Yeah, I just heard about the meeting and was curious. I'm just going to listen in. I'm not representing any group.
Cool. Awesome. Okay, so Gary, do you want to start with emergency management?
Yes, if you've been listening to the governor for the last hour, you learned that Friday he's going to announce further restrictions or the extension of the current restrictions. One thing I would like to mention, yesterday there was an hour-long program put on by the Geisel School of Medicine. Dr. Lucy, who's a world-renowned epidemiologist, was making a presentation from Georgetown University, and he emphasized using the term physical distance rather than social distance, and I think that's something to think about. If you read the letter that Monique and I had in the newspapers, we used physical distance for the similar reason. Social distance is a concern to many in that this is a time when we definitely need to not have social distance. We need to be able to communicate with our friends, families, and neighbors, whether it's by phone, email, or video conference like this. This is a time when we need to check in on people, especially those that live alone. This isolation can cause a whole lot of problems. We used to call it cabin fever by March, but The pandemic has extended it well beyond March. Just check on people for their well-being. As you might have heard Mike Sherling, the Commissioner of Public Safety, say a couple days ago, excuse me, crime is down, but unfortunately suicides are up. And a lot of that has to do with, I think, being the feeling of being left alone and all the stress. So I guess my main thing would be to urge everyone to check on others and don't be afraid to say thanks to all those that are on the front line, not just fire, EMS, and law enforcement, but those in the grocery stores that are providing us the service and at checkout, the pharmacies, and the other businesses we're dealing with, and even those restaurants that are doing takeout. Many of them arrange some pretty innovative ways to get us our food without dealing with us directly. So I guess I'd just like to say, keep all those people in mind, and it never hurts to say thank you. And lastly, take a look at the town website, the COVID-19 info that's there. Monique, you've been doing a great job of keeping information up to date there. That's all I have for now.
Cool, thanks, Gary. Dan or Ryan, did you guys have anything additional? I know this is your first time joining. Was there anything you wanted to share with the group?
I don't have anything I need to share with the group at this time.
Okay.
Yeah, same for me. I don't have anything at this point.
Okay, no problem. So I think communications, I don't have too much, like Gary said, so that letter went out last week, and then to several newspapers as well, just kind of the heads up that it was going out. I've been trying to update the website. So if anybody I'm just updating it constantly as people send stuff. So if there's something missing that you want on there, just email me. Otherwise, I'm trying to like reshare things that I see on Facebook to the group and the page, and to Front Porch Forum. I'm not necessarily remembering to post to all of the channels all the time. So if you want something pushed to everything, just tell me that. And then listserv as well. I think that, and one other thing that came out of an idea that came out of the volunteer call that's on Fridays was yard signs to try to reach people who might not be getting like internet updates and things like that. So I reached out to World Cup Supply, but I don't know if they're operational at all right now. Probably not. So they haven't gotten back to me. So we might just look at trying to like get a donation or something to cover that and just buying them. Because Aaron found a cost online that wasn't too bad. So just trying to think about putting something on some main roads or back roads like South Road and things like that. Yeah, I think that's, Danielle, did you have anything additional for communications?
Yeah, I did want to let you know that I had talked to actually Emmy Houseman this morning, and she and Rick are the contacts for Newberry, which is actually called Newberry United, and they have organized themselves into a very similar model that West Newberry is using, with one captain who's sort of reaching out to the community members in their geographical area. So any communications that we want to try and get to Newberry, they can funnel through Rick and Emmy, and they gave me that information, which I'll get you offline. But just to let you know, they have done that. And this is in conjunction with Jeff Morin and the emergency management system in Newberry. So just letting you know that.
Cool, awesome, thank you. Yeah, and just so everybody knows too, so the with a few other towns, I'm just coordinating like and maybe with Sarah and some of the reps, just coordinating like a call just to check in with the other towns and see how we're all doing. So that's just, yeah. Let's see.
Nate?
Yeah, go ahead. Go ahead, Gary.
Monique, Dan Martin has taken over as emergency management director from Ben Ilsley about a week ago. I think I gave you his contact information, but if not, I will.
Yeah, thank you. I included Dan. Yeah. Cool. As far as volunteer coordination, so we're just meeting on Fridays. Yeah, there hasn't been too many needs. We've been keeping the calls pretty quick. Just working on things like I put together a waiver, which I ran by Aaron and for an insurance perspective, and then by Gary and Ted. So I think that piece is all okay. And then we're still kind of working with the town on what the overall structure looks like. So I think, Ted, is that something we can talk about in the meeting this week, select board?
Yeah. I'm sorry to say that when Danielle and I prepared the agenda, I forgot to put an agenda item for Bradford Resilience. But under other business, we can talk about making Bradford Resilience an official town committee, which would then get us under the insurance. And because we'll do that in an item that wasn't officially warned, that means that our following meeting will need to officially, I'm trying to remember what the word is, but basically, yes, ratify, thank you. Ratify that action. So yes, we can do that tomorrow evening, and I apologize that in my haste to get the agenda out, I forgot to add that.
No problem.
That
There's
item,
going on.
but it'll happen. And by the way, if we could go back to communication just for one quick moment, I think, I'm not 100% certain, but I think there's a second little message board somewhere in the BA building. You know, there's one out there right now that says the late fees for dog licenses is being waived until July 1st. I think there's a second sign. So if there's something we want out on the front lawn of the BA, I think we could do that.
Okay.
And the other thing, I just wanted to commend you folks on that wonderful letter. And I have to say, I was disappointed the other day when I went into the post office and saw probably 25 or 30 of them sitting in the recycling bin. But there's only so much you can do. You know, you put the information out there, if people choose not to read it, that's not much we can do about that.
Yep. Yeah. Okay, cool. And then the only other thing I can think is volunteer coordination wise, we talked through not only the waiver, but then having some language on, like we have just a one-page guide on like, make sure you deliver to the doorstep and just kind of help people and get a personal umbrella policy and that kind of stuff. So yeah, I think that's it for volunteer. Unless Aaron, Aaron actually got some signs for the Bradford businesses to say, one, to like link people to the website, to just kind of show support for workers, essential workers, and just kind of like town rallying. So thanks, Aaron, for doing that.
Yeah, they'll be here next Monday.
Cool, awesome. And I'm putting hearts all over the windows if anybody wants hearts in their windows. Town, state government, Ryan?
You pretty much covered it already. We've got the select board meeting tomorrow. We'll talk about making Bradford Resilience the official town committee. Monique and I reached out to BLCT for some guidance about what that committee might look like, but they're a little less than helpful. So we're going to keep trying to figure out the best way to form this committee into something useful. And that's it as far as town goes. I don't know if Sarah has any state updates she wants to share.
Yeah, go ahead, Sarah.
Yeah, a couple of emergency services related things. So it's good that we have Dan and Ryan on the call today. We're working on easing some requirements for emergency medical personnel so that folks can more easily move back and forth between town lines. Currently, they're supposed to be credentialed by their own agency, but we're going to release that for the time being. Extending some ambulance licenses and making sure that health insurers are going to reimburse directly to the EMT company, because currently some insurers will give the reimbursement to the patient who was transported, and that patient may or may not ever realize that they're supposed to turn that over to the ambulance company that provided them service. And then we were being asked to consider allowing county sheriff's departments to access a county's reserve funds in order to backfill for parts of the sheriff's budget that would ordinarily be filled by contracts that they have with construction projects going on around the county. So currently the sheriff's departments are concerned about being able to continue to make their budget. So they are asking us if they can be given permission to tap into the county reserve fund. So that's a few things going on. Oh, the other thing that we're doing is just providing a blanket extension for plumbers and electricians, because all of their licenses that are coming due in the next 3 months require in-person continuing education, which of course can't really happen right now. So we're extending plumbers and electricians so they can hopefully get online training later in the summer, or perhaps just do their in-person after the COVID emergency is lifted. So feel free to reach out if you have any other questions or concerns that you'd like me to elevate. We meet as a group of House chairs across all areas of state government, so I can certainly elevate questions or concerns that people have.
Thanks, Sarah. Ashleen, food access?
Yeah, so food access, I think the food shelves are still putting boxes together, and that's, I haven't heard much other than they're still accepting donations, trying to keep that as clean as possible, but people aren't shopping within the food shelves as far as I know. Then for Little Rivers, we have our food delivery system working with Willing Hands, but we are looking for volunteers to do the grocery shopping for patients and just people in the community in general. But I know we're still waiting on the volunteer, just the waiver and all that, get those ducks in a line. So we are excited for that, and that's all I really have.
Cool. One note too on the food shelves, somebody mentioned yesterday, and I checked with Jenny, that they can deliver if people call Jenny ahead of time and coordinate that with her, which I hadn't known. So.
And actually along those lines too, Mike Reedier at Stagecoach, they are doing deliveries for folks, and he might be able to add more, but they are doing deliveries. I'm not sure if that means food, but they'll do medications and other things. So I think that they would do food deliveries as well.
Let's see, and medical pharmacy health, Ayla on the call.
She might not be on, but we were on the call together yesterday, so I could see.
Okay, cool. Yeah, go ahead.
Okay. So Little Rivers is now a testing site. We will do all patients for Little Rivers who show signs or symptoms or have a referral. But for anyone who's not a patient, we request that they have a referral from their primary care provider. If they currently do not have a primary care provider, then we do need to put them through some sort of a new patient setup at Little Rivers in order to track their care. So if they don't have a primary care provider, call Little Rivers ahead. Don't come to the office, but call. So that's medical. And then Clara Martin Center is doing as much of their, and I don't know if anyone from Clara Martin Center is on the line, but we were just all together yesterday. Well, we weren't actually together. We were virtually together. But anyways, Clara Martin Center is not doing any in-person visits. They're doing similar to the medical televisits. I know that they are still they're trying to support any primary care physician who can prescribe, that the psychiatrist at Clara Martin Center will support that primary care provider in making their best ability to prescribe for a patient, but they're really trying not to do any in-person visits. So that's new patients. It's a little more difficult, but you can call, and if it's an acute situation, they'll work with you.
Cool.
Question.
Oh, yeah, go ahead. Go ahead, Gail.
Ashleen, is the testing site just in Bradford or Wells River as well as Bradford?
Both Wells River and Bradford.
Thanks.
Oh, Ayla, we just sped through health. Sorry, we're ahead of the agenda. I think Ashleen covered everything now. But if there's anything you want to. All right. Mike, Branley, was there anything additional that you might want to add?
Can you hear me?
Yep.
I've been having conversations. I've been doing individual therapy lately, and I just wanted to just throw this out there that as this progresses and goes on, obviously we've talked about anxiety, the ongoing stress, the trauma that the first responders and healthcare workers are experiencing right now. If and when this surge comes to our area, thinking about the grief and loss process of not only individuals but family members, but also broadening out to the community, that's been on the forefront of my mind in terms of how to obviously I can assist individuals with individual therapy, but community-wide, putting that on our radar for how does the community heal from maybe 2 or 3 community member losses. It's a morbid thing to think about, but something that I would rather put on the table rather than kind of wait till it happens. But that's all I had.
Great. No, that's something to think about for sure. I'm curious, like, I just feel like everything I've been seeing, like some of the things I've been doing, it's just from like seeing what other areas are doing. And it's like you said, not a nice thing to like think about, but I do wonder what other areas are doing. So yeah. And Mike, just so you know too, there are some volunteers who have like specified that they have grief counseling or like religion. There's a pastor and some like emergency, I don't know what they're called, but basically like counselors in emergency situations other than grief. And so there's a small kind of volunteer group that's really specifically just going to be focusing on if people mention in the need survey that they'd like support to talk to. There's a group that's kind of trained in that is specifically working on that piece. And so I don't know
Awesome.
where it's connecting you, but yeah.
A lot of employers are offering, employee assistance programs. I know Upper Valley does. So we're making sure that, we're keeping that in front of our employees and offering it to anybody that qualifies under Upper Valley Services. So I know a lot of local employers do have that option for people.
Okay. Great.
Excuse me, I'm thinking about this as well now. So Lisa, a lot of employees offer that, but a lot of employers offer it, but a lot of employees do not take advantage of it.
That's
right?
true.
Right.
It's very true.
And Mike, I'm wondering if, as I'm developing programs, online programs, I'm wondering now about through the library. I mean, everybody can do this and we all have a different image to reach for outreach, but I'm wondering if I could do some sort of discussion with someone like you to answer questions.
I like that
Would
idea.
you be willing to work with me?
Yeah, I'm definitely open to that.
All right, I'll send you an email. We'll see if we can talk on the phone about it.
Great, Gail. Thanks.
Thank you.
Cool. And business, financial, Aaron?
I don't particularly have anything. I don't know if Marvin wants to speak to the idea of maybe expanding the business directory to other towns.
Yeah, go ahead, Marvin.
Hello, can you hear me?
Yeah. Yes. Yep.
Okay. Yeah, we talked about perhaps expanding the directory to the greater Coas region, the 6 towns and the surrounding smaller towns too. But I just don't know whether, does anybody know whether people are using the directory and is anybody updating it? I guess maybe nothing's really changing, but there are only, 20 entries on there or something. And would it be valuable do we think, has everybody taken a minute to look at it and is there any feedback on it? silence is
If
dead.
you haven't seen it, it's if you go to the Bradford-VT.us site, there's a button for the business directory, and then there's a button for submitting business details.
I think that people are so inundated with information right now, but I don't think it hurts to have it everywhere, because even if you're hitting one person, that one person might only be going to that site.
Yeah, I tend to agree. Like, we could just expand that one, but I think a lot of people are looking to like listservs and Facebook for updates. Like, I've been on calls with the chambers for the Upper Valley area, and they're all struggling with the same thing. Like, do we put out yet another directory, or do we just share the Facebook posts of the businesses that are updating their Facebook page? Which I've just been, as I see stuff on my own personal feed, I just share it to the Connecting Bradford Facebook group. If it's like Colatina's changing their hours, or Peyton Place saying they're doing delivery or whatever. So I just also encourage people, that's a public, or it's a private group, but once you're in it, you can share whatever you want to it. So I encourage other people to help share stuff they might be seeing in their feeds. So yeah, I think we do it, Marvin, but we just don't take it to heart if people don't update it. Yes.
Hey, Monique, one thing that I wanted to add, if we're going to do, if we're going to expand that or even leave it the same, is I think we ought to add another column on kind of how to buy gift cards.
Oh, okay.
Because I think it's a good idea to be able to make sure that those businesses have the opportunity, or people have the opportunity to buy gift cards for those places, especially those places that are shut down right now.
Yeah, that's a good idea. And there's like a gazillion buy a gift card to support your local businesses websites that are out there right now. So maybe I'll like try to pull those all together into one spot. I don't know that our local businesses are on them, but I'll check and maybe put them on the website or something too. Okay, great. Support for seniors and adults with differing abilities.
Don't have anything today, that's new either. I checked with all of the people in the group, and nobody really had anything for Bradford.
Okay. Anybody else in the group? Is that still true?
Something?
All right, cool. Thank you. Oh, Carol, one thing that, somebody from Waterbury actually reached out to the Vermont Council of Rural, like to me, but Vermont Council of Rural Development, because we've been meeting with all the mutual aid groups around the state, and they were trying to coordinate masks for nursing homes, because they reached out to the state organization kind of overarching of nursing homes and said that there are many needs. I don't know if that's true in our area, but we're trying to, like, I guess, coordinate a state mask making effort for nursing homes.
Yeah. A couple of weeks ago, Zach had said that there was a need at Margaret Pratt, but that may have been filled, or they may still have some need. He didn't mention it in his email, but.
Okay.
And I don't know about the smaller care homes like Oasis and other ones in Bradford.
Yeah, could you maybe
Marianne might know.
Could you maybe just check in over the next week with like Kate and stuff for next week's call?
Yeah, I will.
Cool.
Yeah.
Thank you. Schools, Bruce?
So we are in the throes of moving from what was called maintenance of learning to a continuance of learning, with a lot of guidance from the Agency of Education, trying to turn that into a practical program for children and parents is a bit of a challenge. I think those communications are going out almost as we speak. April 13th was the deadline for our plan to go to the agency, and we are already executing on that plan. So we're negotiating the terrain of, well, I don't know what the right term is. Rather than social media, it's social safety. There's a huge a plethora of applications that teachers and children and families can use, and one of the real challenges is making sure that we're doing things coherently and safely, and we're making progress on that, but it's a work in progress for sure. And then on the food front, we've included the state was able to achieve a waiver for communities like Thetford that didn't initially qualify for the summer food program, and so we now have all of the towns in our SU from Thetford all the way up to Wells River and beyond, and we are now pushing out in the neighborhood of 1,100 double meal packets a day in the communities. And we just sent out a communication trying to help people understand that this is actually a pre-existing federal program that we were able to access early on. And it's these meals are all federally reimbursable. So it just happened that schools were in a position, if they jumped on it and could take advantage of it, to actually make a huge difference in this area.
Awesome, thank you.
Can
Go
I
ahead.
ask a question?
Yep.
Sorry, I'm full of questions, aren't I?
I was gonna turn it over to you anyway, so go ahead.
So Bruce, I'm wondering, maybe I should know this, but where do people communicate that want to join on to the program, the delivery program?
So it varies a little bit from community to community. Waits River is doing a door-to-door delivery, or the two communities of Waits River. In the rest of our communities, we're using our regular afternoon bus stops to deliver the food. All you really have to do is show up.
Okay.
And that's it.
All right. And if it's my turn, so I did reach out to Darlene about, last week I had spoken about some books that I have to pass out, and I didn't receive any. I know that there's a lot going on in the office, so I didn't get a response. I'm going to reach out again. If anybody has any ideas or thoughts on that, I'd love to hear about it. But anyway, I am going to try to get materials out, new materials that don't need to come back. I'm also getting emails all the time from kids that want books, which is a drag because I just can't give them out right now. I'm glad they're reaching out to the library, but I can't help them. I just found out that the summer programming here will probably not happen. So I'm trying to figure out or reach out to the rec department, because I want to be able to, if we're allowed to, offer summer programming, and I want to ask the school, or I'm going to have to do it off site because we're having renovations going on here. And the summertime is the biggest time for kids, especially in our town where we don't have a lot of other options for them. So if anybody, Bruce or Danielle or somebody, can help me get in on maybe offering programs at the school this summer or through the rec department. I mean, I have connections, but I just want you guys to know that I'm reaching out for that too, okay? Because I have funding, I can bring in and have big programs like VINs or whatever. I usually do 3 or 4 different big programs, and I think that this year might be especially, I especially want to do some outreach like that.
Ryan, go ahead, Gil.
No.
Well, just a quick, I'm assuming that you already know this, but Kate Paxton would be a critical contact for anything
Right.
to discussion around use of PES.
The building, okay.
Ted, or
Gail?
as far as the rec department is, I think I saw the job postings in the paper, but I didn't know if there was any updates for Gail or anybody.
Yeah, there's no update at this point. I don't want to get ahead of myself, but I think it's highly questionable whether or not the town rec program will be running anything this summer, both given the fact that we're looking for a new rec director, and with the public health crisis, I'm just not sure all the moving parts can come together in time. But that's not, there's no definite decision on that.
Okay. Brian, did you try to say something?
Yeah, I just wanted to ask Gail, and I'm not sure about the logistics of doing this, but since you're not able to send out books, I know that we have tons of books at our house that our children have read. And I wonder if there's any way to do kind of a central collection area where we could set those books aside for 3 days, so that they're COVID clean, and then have, put together bundles to get out to kids at an appropriate reading level.
Right. So I can't do that from the library necessarily right now, but I'll talk to you about that. Let's see if we can do something on the side. It would, the packaging up and quarantining is more than 3 days. And, we'd have to figure something out. But I mean, I have a gazillion books here I'd love to give out, but I can't, it's just not the right time right now. We have to follow these rules right now so that it works for everybody, I feel. And I don't know what to say about that. Let me think about it, and we'll talk to each other and see what we can come up with. But it's I have so many books I'd love to give away, but it's not the right time, I feel like.
Yeah, if you can come up with a plan, let me know how I can help.
Absolutely. Thank you.
Well, thank you. And for churches, I don't think Carol Taylor's on. She emailed me and just said there was no major updates from the churches right now. Just this kind of the same from the last few weeks. They've been monetarily kind of supporting Food Shelf and some individuals as needed. Housing, Marcy? Yeah.
Can you hear me?
Yes. Yep.
Okay. Because I'm in my truck doing trash pickup at tenant houses. So I didn't have hard to believe, but I didn't have a chance to check around with everyone, and I don't know if anybody in my group is online. I can report that surprisingly, all my tenants paid their rents on time this month, which is unheard of. But I don't anticipate that continuing, and I would imagine that smaller landlords are going to have a lot of trouble. And there really appears to be little or no resources for smaller for-profit landlords ongoing. So they will have difficulty paying their taxes, their property, their water bills, et cetera. But I also had a couple of other comments that don't really apply to housing. But one thing that does is I'm wondering what out-of-town landlords are getting in terms of that mailing that was done from the town with all the links. A lot of my tenants don't have local mailing addresses, or in my experience even appear to pick up their mail regularly. So I'm physically making copies and leaving them with them. And I'm wondering what's happening with, people that live in Corinth or Orford or another state that own rental properties, if it was sent out by the grand list or a different method.
Yeah, it was every door direct mail, so it would have been every mailbox in town. So
it doesn't reach out of town people.
Right. Yep.
Okay. Also, I was speaking to Little Rivers, and they mentioned that you can make masks using old bed sheets because apparently it's hard to find material. And they said they would be accepting those. They're not necessarily 100% cotton, but and that would certainly be okay for people to use. And let me see what else. Kevin Geiger from Two Rivers is coordinating the COVID-19 response for Two Rivers, and he may be a good resource to loop into these things because he has a pretty wide swath of connections. And then the other thing is I've been listening to Andrew Cuomo's press conferences on a daily basis, and I find them really useful in terms of the information that he's providing and his sort of down-to-earth perspective on things. And it's usually on around 11 o'clock in the morning. And my daughter found a podcast from Mr. Levitt, the headmaster for St. Johnsbury Academy. He's, at least the last couple of days, recording his chapel podcast. And I listened to them. I found them very positive in terms of what he was saying. And so I just sort of offer that out to people. It's easy to find. You just go to the St. Johnsbury Academy website and you can find it. And one of the things that Andrew Cuomo has been mentioning is that what's happening in New York City is that there's been a real decline in non-COVID 19 admissions to the hospital because they're pretty much overrun. But it may also be because people are afraid to go get care. And I don't know quite how to reach or deal with that, but I can tell you that I had an appointment at Little Rivers and I just canceled it because I figured I could wait. And one last thing, oh gosh. There was one more thing. Oh, and my daughter is a teacher in New York City and she's having to do remote learning and they just kicked everybody off of Zoom for security reasons. And what she's been doing is a daily check-in to all of her students. I mean, she has different questions of them because, as you may imagine, she works in the inner city. She works in Harlem, and so there's a lot of difficulties in people's home lives. And so she has found that really helpful because there's not the normal outreach from social services that you get in New York City schools, and I imagine here. And so whenever a child opens up to her about some sort of issue, she then forwards it up to the guidance counselor or to the principal to help to reach out to the family. And she's found that some children have expressed that they don't have enough food, and others have indicated some safety issues. And so she has found that really helpful. And it also seems like the children really like, and she teaches 7th graders, really like having that kind of rapport, sort of more personal and really helpful. And I just thought I'd pass that along. So that's it.
Thank you. And there's no additional transportation updates from Mike. I sent out that press release from him for Monday to the whole group. And he can't make these calls, so I'm gonna just schedule a check-in call with him like Wednesday mornings or something, so he has a chance. Ayla, I know you had a few things.
Yeah, just to piggyback a little bit on the cloth masks, I see that Ashleen's putting some information out there. Right now, it is a CDC recommendation to have everyone in the public wear a cloth mask if they're accessible or if they can make them at home. And again, Ashleen put out the recommendations about that. That's from the Dartmouth website, I guess. I don't know if you got my link earlier, Monique. I sent it to you in a personal email. It's a video from the Surgeon General that shows, did you get that?
Yeah, I can put it in the chat.
Okay. So that might be a good idea to distribute. And Carol, that is one thing I was thinking about for the elder community is just, how do we get them masks if they don't have them? Are they aware that they should be wearing them out in public? That sort of thing. And I don't know if there's any resources. I know the clinics and the hospitals are getting a lot of support with masks, which is wonderful, but is there anybody out in the community that's distributing masks for people that may need them?
So that was a thing that came up on the volunteer call on Friday too, is that volunteers don't necessarily have masks. So we're trying to find somebody who coordinate mask gathering for volunteers who are doing groceries and stuff.
Upper Valley Services is providing PPE kits to all of our home providers and our direct support staff. And, all our staff, we're mailing out PPE kits to everybody that we're connected with. So, and of course, I think that's limited. We're trying to, our frontline people are first and then kind of prioritizing, based on contact. But, Upper Valley is definitely sending out PPE equipment.
Okay, great. Yeah, that's the link that Monique's sharing with the video right now. It's a nice one from, again, it's the Surgeon General does it, but basically shows anybody at home within 20 seconds how to make a quick mask that's just usable and yeah, anybody can make one. So,
Carol, did you have anything you wanted to add?
Now, I had checked with Vicki to see if she had masks for the volunteers, and she never got back to me.
Okay.
But certainly Meals on Wheels could be one distribution point for masks to the community.
Okay.
I'll check back in with her.
Okay, that'd be awesome. And I know, just an update, Ashley put it in the chat. So there is the drop off at Bliss Village store for Dartmouth masks, and then there's a drop off at the local Buzz for Little Rivers healthcare masks. Somebody on Facebook just asked if there could be another location for APD. I don't know how many locations is too many locations for Bradford, but I tried to steer them towards Upper Valley Strong, which a main focus for Upper Valley Strong, which is a regional kind of volunteer organization, kind of like this, but Upper Valley wide, with Dartmouth Hitchcock. So their focus this week is on masks as well. So I tried to point them to them as well, because they already have like a whole structure of volunteers and direct connections to the hospitals. So we'll try not to add yet another drop-off point. Yeah, Gail. Oh, you're muted.
Sorry, everybody. So I hope I didn't miss something, but in case I'm repeating myself, but I have a patron that contacted me, a friend patron that contacted me, is making kits, mask kits. And so she's looking for people to sew them for Little Rivers. And so do you have something set up already that I should communicate to, or should I reach out on my own?
Let me email maybe you, and it's probably Priscilla, right? And then there's a few people that are all maybe working on Little River stuff that aren't quite coordinated. So I will email you with that.
Okay, cool. I won't do anything yet. I'll wait for your email.
But there is a drop-off point at the local Buzz. I think is the go-to spot for Little Rivers masks, because they don't want them going to the clinics.
Yeah, sorry. So just to jump in a little bit, I also had some feedback from Kevin Connolly, who's Priscilla's husband. So I haven't spoken directly to Priscilla, but we have the drop-off at the Buzz, or sorry, the pickup at the Buzz and the drop-off, both happening at the Buzz. But the pickup for the kits, my understanding right now is they didn't want it to be public because there's some sort of like small group who knows they're in the know. So I didn't do that. But if it becomes something,
we just need to get Gail mask makers for Priscilla to bring them to the Buzz.
Okay,
cool. It's all related. Awesome. Yeah, anybody else? Anybody have questions for anybody, or anything that you wanted to add from the discussion?
I just had a patron drop off a mask for me, and it matches my shirt beautifully.
Awesome.
I thought that was cool.
That is.
Monique, I want to ask Bruce, is the SU moving forward with moving into the new building? What's the status of that?
Yes, we are actually. Dante is working on it as we speak, doing prep work, trying to keep it to a minimum. But yeah, we are moving forward with that.
I just wanted to add with Ayla and Kate Beaton on the phone yesterday, I thought it was a really amazing number. Apparently the buses have delivered 2,000 meals a day, which is amazing.
It's awesome. Cool. And Ayla, maybe, so Zach Shepard was on the Bradford Business Association call yesterday and mentioned that it was just hopeful, I guess, is the testing is taking like 8 hours now versus multiple days. If somebody is, okay, well, maybe not. Anyways, you got one back in 8 hours. You made everybody else hopeful, but all right. Anybody else? All right, awesome. Well, thank you. Same time next week. In the meantime, just email if there's anything you want added to the website or anything like that, and I'll email the few people that we talked about. Cool. Thank you. Have a good week.
Thanks, Monique.
All right, bye guys.
Stay safe, everyone.
You too.